Hello, everybody. I'm happy to be here with you. We are here on the Constellations specifically dedicated to supporting Ukrainian people who use drugs uh, in the terrible situation of the war of Russia against Ukraine. We have a lot of feelings about this, and we will share it. We have a lot of stories of solidarity, proudness, suffering, death of our friends. But majority of such meetings, we need to start with the couple of moments remembering our friends who died in this war. Started in 2014, and now it's already more than 6 months of the suffering of all Ukraine. So we will start from this moment of silence, remembering friends we lost already. Thank you for solidarity with us. Actually, Ukraine is very important country, is very big country in Europe, and in this unprecedented crisis caused by war, we have millions of people. It's 1/3 of population who lost their constant home. Either they move within the country or move abroad. And it's really millions. The calculation is hard, but millions, more than 5 million who left Ukraine. And most of these people are women with children who are leaving country, who are fleeing from the country without means to survive, but with their brains, with their hands, and what they are doing in the hosting countries, they start working and start supporting Ukrainian army in fight against the Russian army, and that's what we are doing all together. This like saying this, nothing new about the wars we see, but what really hurt us as the most among Ukrainians, this cruelty with which Russia is taking and treating our people in occupied territory. That's why we encourage what we are doing as a civil society organization, as a community all together, to people who use drugs, to other key population, to sex workers, LGBTQI, to imprisoned people, to just our friends and families. What we are doing, we encourage them to evacuate, and that's the key point, what we need to do, because when they are in occupied territory, they are in a big danger, and danger for surviving of people who use drugs, of LGBT sex workers, and key population, marginalized populations, much bigger than you could imagine. So this tortures, this searching for people who are getting OST on occupied territories, to kill them, to torture them, to put them in prison. This rapes and violence against women, that's absolutely unprecedented. That's why Ukraine is calling this genocide against the Ukrainian nation, against Ukrainians, and it's not correct to compare the suffering, but in this case, marginalized group, people who use drugs or LGBTQI, people who need the most to be supported, they are suffering more and more. In addition, additional burden is put by the Russian repressive drug policy against them, and non-tolerant attitude, and all values of Russian state, which really totalitarian, authoritarian state with the neglecting of human rights. So for us, this full-scale war became the big crisis and the big pain. And I need to say that none of Ukrainians seriously being afraid of it, but didn't expect that it will happen in such scale. The occupation, the rape, the violence, the tortures. But we are now already more than 6 months after it. And we wanted to share stories. We wanted to share, and you could see women here on the screen, and I respect them very much because these are the women who managed to cope with this crisis, to help their families, to help other people who are in the problem, to mobilize resources, their own resources and resources from the external donors, partners, to help and to make the harm reduction services, to make shelters for people who use drugs, to make support for people, women who use drugs, available within the country and in neighboring country who are hosting us. So we are here. I see on my screen the three heroes, heroines, and we will hear their stories. And you could ask questions. So we will go through our three stories, and then you could ask the questions, and we will be very happy to hear your perspective and to hear your doubts and thinking, because we are all let's say, maybe it's all only from our perspective, from regional perspective in Eastern Europe and Central Asia, but this war really changed our world completely, because this changed the landscape, political landscape, human rights landscape, and this changed situation for all the people who are living in this region now, in the worst way. And we don't know how it's seen from the global, but what we see and what we feel, it's global solidarity on the state, national level, and on the level of each citizen. So we are grateful for this, and we are happy to share with you and to think together what could be done more, and how we could reverse this crisis into maybe some opportunities. First, opportunity to survive. Second, opportunity to change the country in even better way as we had before. So I'm here as a moderator. I'm Anna Dovbach, Eurasian Harm Reduction Association, and we are actually starting from the stories. Let's say, what are the key challenges for people who use drugs in the situation of occupation, war, and fleeing from their places? Natural, we could understand that people who use drugs, they are using illegal psychoactive substances. It means that when they are moving from place where they lived, they are losing not only place to live, not only their jobs, not only safety for their families, they need to move together with the family. So it means that they need to find resources to buy basic medicine, to buy food, to buy milk formulas for kids, to find a place for all family. But in the same time, they need to find drugs, and in this case, opioid substitution treatment helps a lot. And they need to find this service, opioid substitution treatment. They need to have find harm reduction in a new place. They need to have support and mental health support in a new place. That's the basic problems which are faced, as we see from research, from assessments. But I'm coming to Velta, who is a leader and activist from the Club NA in Kiev, and it's community-based harm reduction organization. Velta is one of the well-known trainer for the peer workers. She's consultant on community mobilization in Ukrainian network of people using drugs called Volna. And she is, like, I know her as a regional and global women's movement activist in developing system to supporting women in situation of gender-based violence. Actually, Velta was in Kiev all the time, and her colleagues in Club NA and supportive club and shelters for women survived gender-based violence, actually that those who supported women in this situation. And my question to Velta actually is about how harm reduction community, how your organization changed their services, how you survived, with what you are supporting your clients, and actually what are the now what are the needs of your people you are supporting now. Velta, please.
Thank you, Anna, for this great inviting for me. I think for me, most important of all of my identification, it is just I'm a woman who uses drugs, and for me, it's really most important because our organization, Club NA, it is community-based organization, and we were created at 1993, and then we was officially registered in 2001. 2001, yeah. And for us, it was mission, it was our goal to support each other, to help each other, because we saw then our needs of people who uses drugs, they are important only for us. Nobody does not want to hear about people who use drugs, to support these people, because really high level of stigma and discrimination. And so all our work is about support people who use drugs, and also women who are in situation of violence, different women from key populations. Yeah. So when it was 24th of February, next day we were in our office. Yeah. And we discussed how we can support people now. And we really saw that harm reduction program is most important for now, because then pharmacies was closed, and open sustainable therapy sites, OST sites of for people who use drugs. They were private clinics were closed then, and more really many people were without necessary treatment for them. Yeah, and also they have not needles, they have not necessary pills, and we saw that we need to continue harm reduction programs in any way, and we have needles, and we did not know then do we have some payment for our work in those period. But for us, it was not question, because for us that work, it was as, I don't know, maybe a resource for saving our mental health. Because when you feeling that you are important for other, and you are really on your important place in this war situation, I think it was really useful for us, and for our mental health. I think it saved us then. Yeah. And so we had 13 social workers, and they were ready to work in outreach, so in streets. And it was really difficult because we have air warnings. Um, we have then rockets strikes in Kiev, but people were going to streets and sharing consultations, needles, syringes, HIV testing. Yeah, and then we saw that many people they were without their work, without treatment, without money, and public transport did not work then. And it was a real awful situation because these people they have lack of resources, financial resources in Pacific time, but in the war it was really awful. So we decided to uh, seek resources for help, for direct help to people, and we found it. We bought so many meal and medicines and pampers and hygienic supplies for women. Yeah, so many. And it was difficult because our administrative staff team, we were not ready for this, for both all of this. Yeah, but we bought and shared, we bought and shared. Also, we give direct financial um, direct finances for people who needed to rent, to pay for utilities, for other needs. Yeah, and people who came, somebody cried, were crying, and they were very grateful for this not big support or help, because they spoke that they thought nobody did not see them and their needs. Uh, and when we give them this support, we had only one question: do you use drugs? Yes. Okay. What help do you need? We can give you. We don't need your passport, your data, just if you member of our community, we can help you. And these people then they invited their friends, their wives. They came with children also, and it was about peer support in community, because when other people came to us, we did not help them. We redirect them to other organization. For us, we have only focus for our community, and I think it's important because we know about their needs, we have resources, and yeah. And for now, we continued our harm reduction program. Our social workers, they go to OST sites, to pharmacies, to outreach marshruts for drug dealers in Kiev and Kiev region, and shared not only syringes and needles and consultations, but also food packets, medicines, hygienic supplies for people. And important part of our work, it's harm reduction work, and also it's work support for women who use drugs, for sex workers, for HIV positive women in situation of gender-based violence. And we have shelter. It's unique shelter for Ukraine because it is shelter, community-led shelter. We have not any control or professional workers in this shelter. So the shelter is for women who use drugs in situation of violence or in situation of homeless. And they led this shelter themselves. Yeah. And it is, we don't need any passports, any documents for this shelter. We don't need any analysis or other data. Only women who use drugs and who need this service. Yeah, and we have some rules of this shelter, but it's really easy. Yeah, and we have not. We have in Ukraine discrimination rules for government shelters about women who use drugs. If woman uses drugs, they can't access to the shelter because we have this law in Ukraine. But in our shelter, if a woman uses drugs, they can access with children also. We have cats in our shelter. Yeah. And we have methodology wings. Women initiated new goals for safety. It is methodology of Columbia University Social Intervention Group. And it is, when I heard about this methodology first time, I really love it because before it, all programs for women who uses drugs in situation of violence, it was about just exit from situation of violence. Just stop it, and if you exit, we can help you. And it's about drug policy, I think, because when we see when when I use drugs, I often heard if you need to help, you need to stop drug using, and then we can help you. So, and about violence, it was same situation. If you need to help, you can you need to exit of situation of violence, and we can help you. But if a woman use drugs, it's really difficult to exit of situation of violence because, for example, if abuser is her husband or a boyfriend, and he give to her drugs, substance, and this fear to be without psychoactive substance, it is fear more bigger than fear to be in situation of violence today. Because if I will be without drugs today, I will feel very badly, in mental health, in physical health. But and it is 100%. If I will be in situation of violence now, I did not know what level it will be, and so. And it is really difficult. So Wings, it is about safety for women, and it does not matter she will be exit of situation of violence now, or she did not can do it now. Important women must be alive in safety in those situations where she is now. It is as harm reduction, but in situation of gender-based violence. So I really love this methodology, Wings, and we did it for 3 years and in 13 regions of Ukraine. Uh, and for now, our facilitators, peer facilitators, because for us it was really important to educate, to train women from community and create peer facilitators for Wings methodology. And for now, they continue this work in bomb shelters. For example, in Mykolaiv, I'm really proud of work of these women because in Kiev, for now, it is more easy. We have not rocket strikes today, and it really more easy. In Mykolaiv, in Zaporizhia, it's a really awful situation, and we have facilitators there who conducted these wings groups with other women there, and it's really fantastic. Um, so for now, we have harm reduction programs by peer social workers. All people in our organization are from community. Only 2 women are not, but we trust them. They are many years with us. Um, and we have strong program for women who use drugs, for sex workers in situation of gender-based violence. It is shelter, it is Wings methodology. And for now, we starting work to adapt this methodology in wartime. We connected with Louisa Gilbert. She is creator of this methodology, and we started this process because we see this need. And for now, we start advocacy work for development of alternative model of shelters for women who uses drugs, because we have the shelter and we see that we need the law for this shelter. Yeah, but uh, I can't say that I'm excited about this work. I do not love advocacy work. I love direct help for people, but I see that if I need this, so if I need the shelter and I see other women who need the shelter, so we need advocacy work. It
That's
works such.
true.
Yeah, and also it's about Kiev. We did it in Kiev and 13 regions about situation of violence. And also I'm working in PUD-UA. It's all Ukrainian network of people who use drugs. And they did really many work in all regions of Ukraine for now with evacuation of people who use drugs, with financial help with food and medicines, because our situation in Kiev is just example, and all people who uses drugs, most of people who use drugs in different regions has such needs, and we face this stigma and discrimination. For example, when we evacuated people who uses drugs and They go to some temporary housing for people who are running from war. When this administrative staff of this temporary housing, they know about this, there are people who uses drugs, they say no, we did not want these people here with normal people. Yeah, and we are fighting against this stigma, and but I see that we really I need so many work uh, against stigma and discrimination for people who use drugs in our country now during the war, after our win, because this situation is really not good with this. And also, I think we need some risk plan because when OST therapy sites have some problems with medications, it was really difficult for our people. And yeah, Volna did many works for advocate this, and for now we have uh, good situation with this, and most of people who use drugs, they can get the treatment, the government treatment. Yeah, but it was really difficult process, so I think we need some risk plan for future about this. And I think our community, we need to be ready to these troubles and bad situation with this. What needs we need for now? It continues. We need financial resources for people who uses drugs. We need food. We need medicines. About Club NA, we have all of this for now. We really have strong fundraising knowledges. Yeah, for all of these ages of our work. And we have our brand, because Club NA is about brand, because we are from 20s first year, and we have so many projects and results. So, and we have for now and financial resources for people, and for women, different psychologist consultation. For now, we prepared to open safe space, community center for people who use drugs in Kiev. Yeah, and we are working to training of peer psychologists, to community members, to social workers in our organization. So all our plans, all our goals, they are possible for now. But if you want to support our not big organization, you can find us in Facebook. We have site, and I can
We will share
promise.
information. Yeah.
And, and I can promise that your money go direct to food, to medicines, to hygienic supplies for women, because all our work, it is open, and you can see our publication on Facebook, so many of photo and information. So if you want, you can. But for now, we really have all necessary for women and men who use drugs in Kiev. And we have strong peer social workers who have really, I'm really so proud of this work, because I'm for now, I started as social worker in Club NA 15 years ago, I think. And for now, I'm chair of this organization, and I'm in staff, in administrative. Sometimes I go to street to outreach, to help people to train, but I did not work uh, every day, and they work, and it's really hard. And for now we have some power banks, some thermos, some warm clothes for them, because it's really hard work. Yeah, so I think I can finish for now. Maybe if people have question, I can answer it after all presentations. Thank you for this possibility to share our experience, because uh, when I see this support from other countries to Ukraine, it is really motivated me to wait our win, because we win. It's 100 of percent. We win soon, but this waiting, it's really hard. And when I see this support, it's really important for me. Thank you.
Thank you, Vilta. And actually, like, look, when you are sitting in a safe place, you could not imagine that people, when the bombs are coming in your city, and you are not living in the safe city, and Kiev is divided on the separate places, and you could not go from one part of the city to another, and actually it's not safe even go out in the street, and you have the all restrictions to go out. In this situation, outreach workers going out to help their people, and they are opening their offices and homes to bring people to the safe place and to give them the food and shelter. And it's all happening in winter. And now when the winter will come, organizations are already, even if they lost their homes, social workers still working. And important point for me, that this work, this supporting other people, give them motivation to live. And for the entire, I know from psychologists all over the globe, they're saying it's impossible to consult and to give the crisis consultation when you are in bomb shelter. But that's what Ukrainians are doing. When you are in danger, you're still helping other people in danger. And yes, we will have mental health issues, but that's some absolutely everyday heroical actions which keep people alive, because they are providing help. They are busy with their work, which don't give us the opportunity to think about the global stuff, about the suffering, or compare with the peaceful time. No, we have work we are doing, and that's meaningful, and it's important to survive now all together as a community. Thank you, Velta, for this work, and I'm really proud of being knowing you and being of support to you. So that's absolutely amazing job which your team is doing, and Volna is doing all over all around the Ukraine. Actually, those women and children who went to abroad, they face, of course, plenty of challenges. And I invite we invited Magdalena Bartnik, executive director of Precursor Foundation. She's leading harm reduction organization in Poland. That is leading a harm reduction organization in Poland. Poland was the country who absolutely, like, extremely helpful and extremely open and extremely supportive to all these millions of Ukrainians who flee there from the bombings and from the dangerous places. And actually, as the harm reduction and drug policy advocate, Magda was one of the best supporter of our people, all time in the telephone finding way to get resources. And she will talk about the significance of harm reduction in times of war in relations to activists from the neighboring countries. And actually, from her experience providing not only services but often temporary shelters, food, basic medicine and support to women and children from Ukraine. Magda, please share your story.
Yes, thank you. Thank you for having me here. I want to start with a very short introduction. I was thinking about this discussion, and about the topic. And there are two things I want to say, very general, but I need to say them. First of all, is that harm reduction itself was always about saving lives and protecting people. So now this is even more important, but it is the meaning of it. And the second thing that is that there's a war going on for decades now, and it's war on people who use drugs. So in this context, I think it's important to have it in mind that there was already war against people in very in all world, but in this context. So to tell you a bit about what happened and how we were able to help refugees. So the mobilization, this is not the best word, but among harm reduction community in the beginning of war, well, actually, first people started to reach us in April, the beginning of April. So it wasn't just like immediately after the war started. But the mobilization among wider community, harm reduction community, was enormous from the beginning. This mutual support and this flexibility and adjusting to the circumstances in a way, like navigating the system in different countries, because it's very different in different countries. So it's not that simple to just operate in the same way. So the first people that contacted us through emails and online and communicators, it was around April, and to really understand what happened, I need to say just a little bit about the situation when people were fleeing war. So there were thousands and thousands of people, mostly women with children, crossing the border, and there were Poles, like citizens, helping them. It was not state organized. So at the beginning and for quite a long time, it was the people that wanted to help individuals going to the border and taking families or children, older people to their houses in whole the country. And that was really amazing to see this mobilization, to see this, to seeing us so united and wanting to help for me. And this is also important in terms of how then we work with people. It was actually, I think, the first time in my life that I was really proud to be Pole, to really seeing that we wanted to help, and against all odds, and seeing how and challenging this all is. People were just welcoming those in need to their homes. So we first started to get people starting to reach us while they were hosted in whole country, in different places. These were mostly women with kids, and this is also a very important element in all this story. Saying that we need, let's say, we need OST treatment or antiretroviral treatment. Once being in a small villages or small cities all around, there wasn't any idea that if someone goes to live further from bigger city, the accessibility to service is taken care of. No, someone could get to the car, go to the host to the family that wanted to host this person, and then just not being able to reach any service, not that easily. So first we got in touch and we helped people on every step in reaching treatment, like scheduling contacts and dates with the programs themselves. For me, the moment of getting in touch and talking with each other is crucial till now, meaning that for many women, we are the only contact they have in terms of someone to talk with or someone to share what they're going through, or what they how are they now. And there's been a lot of barriers and challenges in terms of helping people to get in treatment, because you have to know that opioid substitution treatment in Poland functions in big programs in bigger cities. So patients have to go there to pick up the medicine, but they have to go to these bigger cities. So there were many barriers, like logistical barriers, how to get there. Also language and communication. It was very difficult to, because the staff in these clinics very often doesn't speak Ukrainian or Russian, just to communicate with people. So it was challenging for us, but it was also a huge challenge and a sense of insecurity for people, for refugees themselves. So our aim and our goal was to make them, to make sure that they feel safe or safer with our help. And we would do anything to help them getting in treatment. And it was happening. So we did manage to get every single person to the treatment. There was not one case that someone was neglected or couldn't get the treatment. We were mediating between the patients and the programs, because the communication is not always very, very easy. So the biggest barrier, and it's like, let's say, like universal, and Velta was talking about this, is stigma which doesn't know borders. So there were cases of people that didn't disclose their HIV status or drug use, being afraid of losing shelter, losing the safe space to live for some time. And it caused also, I mean, we also were intervening, but this is work that has to be done more structural way. So it's not just one case. We've been in touch with all the people that we helped and supported till now, and since some time we are also working with people whose drugs that reach our service and outreach, and through the outreach work. And it's also a different challenges. So we are now providing food and clothing and basic medicines for people when they come to our place. But there are still many challenges in terms of availability of shelters and safe place to stay, and also connected with the barriers in terms of getting into treatment. I mean, the barriers that make it very difficult to really continue without any problems. Yeah, maybe I will finish now and then continue if I have any question.
Thank you, Magda. I need to say for the general comment that all the support from Polish harm reduction organizations, Hungarian, Slovak, German, organization from Czechia, from Moldova, is happening in situation when all this organization actually do not have enough resources for harm reduction, like it's not in luxury situation that they're providing this help. It's mostly voluntarily support, which is not supported by the municipality or state. So the challenge is that harm reduction in Europe is not in very good position, and it's not organizations who have plenty of resources. They have very, very limited resources, and these barriers, which recognized by Ukrainians, came to the country, barriers in geographical access to harm reduction or opioid substitution treatment, these barriers to get shelter for women who use drugs in European country who are hosting Ukrainians. They didn't appear with Ukrainians came to the country. They always did, but the local community used to not to have these services, let's say. They used to have this barrier, to overcome this barrier to get this support. And now with Ukrainians, it's became very, very clear to all of us who are advocating for harm reduction, but also for the local community. I hope that the local community and government recognized how unfriendly and how high threshold this majority of services in Europe for people using drugs are. But that's about advocacy agenda. And from the point of view of a personal point of view, I need to say that hosting countries, and Poland first of all, it's just exemplary and absolutely unprecedented support. And I couldn't imagine how Poland could help more. Thank you very much for this support, for this help, and actually for continuing supporting, because now the winter is coming, and it's coming not only in Ukraine, where there will be challenges with electricity, heating, food, and everything, but also to Poland, where all this costs a lot, and where there are not such a lot of jobs, and Ukrainians are staying there as in safe place to, and we all need to have job and food and place to live. So it's not coming very optimistic in my speeches. Sorry for this. And actually, maybe this our solidarity will help us to be a bit more optimistic and self-supporting, at least, and keep ourselves alive. I'm coming to our next speaker, Oля Bilaeva, program coordinator of Eurasian Network of People Using Drugs. And she's speaking somewhere from Dnipro, one of the city we are worried about during all these days, and now even more than ever, because that's the constant bombing. And actually, Ola and Food is supporting people who use drugs from most affected cities, and she is very strong advocate. And actually, my question to Ola is about her, like how you assess what are the main challenges for people who use drugs, and what are the main needs for now, if people who are listening to us want to support, what they need to do to help us, to help your people, to help you and your community in there.
Legal world. We are vulnerable. We are all vulnerable. Well, a lot of repression, violence of our rights, it's coming from the totalitarian repressive regime. And for people who use drugs, also for psychoactive substances, the main point is to be in the legal, be legal as people who use drugs without any conditions. Because now we can say about the Ukraine, and we can talk now, we can think together now about how the drug scene is changing. When the beginning of the wider war in this year and Russian aggression, the problem is we are in Eastern Europe, Central Asia country. We forgot about how it feels the recreation purpose of using drugs. It's a privilege only for country with awareness, government with supportive experts, and country where people support each other, where reduce the stigma and discrimination, where you fight the corruption. And now we are in the same way to go ahead, to go the legal work, to go to the support each other. And as for drugs now, it's the first point, how to feel good. The first, you know that you get the good substances, but it's impossible. The bad quality of illegal drugs, it's a change in the synthetic and a lot of different mix. And we never know what the side effect would be. And it's awful for our harm reduction program. Last 2 weeks, one man cut his arm under the eye. You imagine the people bought drugs in order to get pleasure, but the side effect, the effect of these drugs is to destroy people, destroy the mental health, destroy the physical health. And last 50 years, the repressive drug control, the, they got they have been doing the same their the goals to bring them a lot of stigma and discrimination against people who use drugs in order nobody help us. In only that one, they will have the two benefits. They have benefits from the illegal drug markets because if they business and they get uh, repressive drug control, they got benefit from this prison and some their daily job to get to catch chase not chase the virus, not people. Yes, chase people, not to fight against the big dealers with a lot of some drugs. Big problem, and we are looking for the possibility to start the laboratory with mass spectrometer with library of our substances on the street in order to stop to using our body like a test and start to check all our illegal drugs on the what is inside in order to be clear how to help people. Because the next step, our psychologists, psychiatrics, they realize how to deal with people who use opiates. They realize how to deal with people who use usually opiates or something like this medicine in the pharmacy. But the substances like alpha PVP, like and it's called like cocaine, but it's nothing next to it's nothing if we compare it, we don't understand what is inside, but it's called like this one. And of course, our doctors don't have any possibility to help us. Uh, criminalization give the main barrier. If you ask help in Delta shelter, I can do it because any information about me, Welta never asked me, and she give me the roof and food. When I ask the help in the government center, they ask about they check me in the data as a woman who use substances, and it closed for me the all other possibility to use my human rights. And we try to be invisible for everyone. We try to be invisible for government supporting system, for uh, prevalence program of the for young people or something like this, because a lot of prevalence programs they lie about drugs. We know how to deal with this. We understand what happened. But when we talk about it, the drug control, what they suggestion, if you if you think about the legal wars, is a lot of drugs. No, a lot of European Union country and Canada and another country, we have the proven that the high level, the more more than people who have the problematic and the uh, addiction because of drugs, us it's these people more in country with repressive drug policy, where
So
we have the
more
big
repressive
barrier.
drug policy is in the country, more people with a problematic use country have. Mhm.
Yeah, yeah. And this is the benefit for repressive drug control. You understand this is a process. We have the some situation. The drug control is the main, the leader of the public opinion, the policeman, the political opinion about how to deal with drugs, how to deal with people who use drugs. But for them, for repressive drug control, is important that for in order to people who use drugs would be more and more on the street, and we will be weakness, we will be poverty, in order to have the in and create a lot of crimes, in order to have benefits and from drugs and from prisons. And now we try, and what we see that the mass spectrometer and drug checking test is one of the main activity which combine the advocacy and practical level in the same time. When we start to say, people, please check what you use, and we can help you when you understand your dosage and how it would be affect. This is a culture of using drug, and we reduce the burden on the economic and the healthcare system in Ukraine, because we understand that we need to support our country from the Russia. And that's why we try to self-support each other. We try to not use the money or the humanitarian supporting which bring in Ukraine for our army, for our people who suffering, who from the territory where now the sound of the war and I think it would be on time to show in the all our region, in the all the world, that the repression against drugs, repression against anything, it brings the war and it brings a lot of problems. And now is the time to destroy repression, drug control as a part of the totalitarian regime. And we do our best together. Thank you.
Thank you, Ola. And actually, again, I'm back to peaceful reality, trying to understand. People are under bomb shelters. People are suffering, and I wouldn't ask my guests now what is the share of your salary which goes to support other people. What is the share of your salary we are all sending to the Ukrainian, to support Ukrainian army and to buy what is needed for Ukrainian army, because it's a very big share. But in the same time, what we hear, the priority are to fight totalitarianism and to fight repressive drug policy in Ukraine as the part of this war for the values of human rights, for the values of harm reduction. And actually, that's how it should work. And in comparison, like one of the part of the story during the wartime, even with all this weapon and hate and suffering, tolerance toward LGBTQI community in Ukraine raises, because people understand the value of human rights and supporting and tolerance and understanding needs of different people. So we have a chance in Ukraine, not easy country. We have a chance now, built upon the European values, values of human rights, values of supporting each other. We could make this innovation. And drug checking, the really true drug checking, it's very innovative for the whole region. And I will not be surprised if it will start with in Dnipro or in Odessa, uh, regions which are affected, which we see in news as a cities bombed right now, and they will start innovating for the whole region harm reduction. That's how does it work in Ukraine. Absolutely amazing country. So now we have you've heard our stories. Maybe you do have some questions or some reflection on it. Um, because we are actually like we are living this experience all together as Ukrainian and Polish and Lithuanian people. We are living through it, learning from every moment of this story. And maybe you haven't heard this, how to say, the standard stories like we are suffering, we need food. Yes, people in Ukraine need food. People in Ukraine need shelters. People in Ukraine really need warm clothes, and first of all of this is necessary to supply to our army. And that's what where we're donating from our salaries. If we have some, that's where we're donating to our friends and family there, because majority of us have friends and family in army. But in the same time, you haven't heard stories of the cry for help. You've heard stories about innovations and advocacy. So we don't have a questions now. Maybe you have some reflections, or yes, and
What
as
may
yes,
I
please.
ask some? Okay. What about the? For me, it was the first my the cultural drug cultural shock was in 2000, 2000 when I hears about the harm reduction program. It was 22 years ago, and I asked, when really somebody care about VN of people who use drugs, about health? No, it's impossible. And when I've seen in my own eyes about this program in different countries in the world where it's born and organized, we did it and continue to do it in our countries. And the values of attitude to each other, how to work, how to support each other. And the second moment when I was shocked, when my brother from Israel, now he's from originally from Russia, 10 years ago left Russia to Israel, and when he organized for the mental health supporting, some part of the survey was information for people who are from repressive drug, uh, the country with repression, also drug policy. And they thought about how repression affected the mental health problems. And we really, even we now we don't realize even the it's how the much problems bring the repressive and corruption drug policy, and we and how to deal with this connection with repressive and mental health. And our sister from community now in Germany, she escaped from war in Ukraine. She was from Verdansk. Wow. And now she is a psychiatric clinic because she lost her moment of to keep herself and the medicine in the mental health. And one of the moment was because people next to her uh, clean their hand after to talk with her. And because of using drugs, because of looks not like usually people, because maybe have some different needs, and they destroy your mind and put lady in the hospital just to treatment. And maybe for this country, for Germany and for Polish, it looks like, oh, it's from Ukrainian, they need more attention, we understand, but we don't want to do it. But the previous experience of these people in Ukraine before war, because of repression and negative and a lot of stigma and hating, you understand the drug control do everything in order our neighbors, our relative hate us. Next step, these are the Russian bombs, and people try to escape from this situation. And when they come to other countries and feel the stigma as people who use drugs or HIV people or people with hepatitis C, it's the last drop on the moment.
Thank you, Olichka, for sharing this. We actually could finalize the our meeting. It was not very optimistic, but I hope that for those who are with us, you felt how you could be brave in even very hard situation. Maybe Velta or Magdalena, you have a couple of words as a final words for our audience. Velta?
Yeah, and I see question in our chat. So yeah, thank you for this question. I think I said something about my feeling of international support. All of our resources in organization Club NA, all these resources are from international support, and it is really motivated us to fight, to wait, to support our army, to support our people. And about help concretely from people from other countries, I think Anya shared this link of Eurasian Harm Reduction Association. So I think people can just donate, and then we really know what way we can direct this your donates. So I don't know when I share some interview or participate in these meetings. It's also about how many all we do, yeah, for people who use drugs, for other people, and we do this important work together in our country and with people from other countries, from Poland. And it's for me about unity, about some such strong network. And I think if we as people can mobilize our resources and support each other in this difficult time, I think we have a really amazing future. Yeah,
Thank you.
thank you.
Maybe a couple of words from Magdalena, please.
Yes, thank you. I just want to impress, I want to say how much amazing work you all do, and it's really impressive. I would have to say much more than just a couple of minutes to really have this feeling that I said everything. But in a sense, it's what you said, Velta. Like this is a paradox. It's strange because in the times of war, in darkness and fear and terrible loss of lives, there is this sense of, I don't know, the new energy or common values that people share. and being united, and really having this sense of being together and wanting to help. This is really strong. And what you're talking about, the services, what in Ukraine now, this is really extraordinary. That's basically what I want to say. And lastly, you will never be alone, and we will be with you till the victory. So we are here. We will be with you.
Thank you. I have nothing to add to this, and actually only support Ukraine. Still support. We still need this help. We need to survive this winter. And actually, all your money you could support to the crowdfunding. We are sending directly to the accounts, to the cards of people who use drugs in Ukraine for them to survive. Actually, what we are saying in this time, all the time, Slava Ukraini, that's what we
Героям
could
слава.
say. Героям слава. Glory to Ukraine, and glory to all who support Ukraine. Thank you very much.
Thank you.
Thank you.